The pause of the vaccine is leaving many concerned for a number of reasons. We have team coverage for you on this evening. Christian Garzone has more on what it means for SUNY schools who had planned to use the vaccine to inoculate students. We'll get to him in a moment. But first, let's turn to Kayla Green with an important update, Kayla, from local health officials.
Maureen, local doctors say, again, this is incredibly rare, but anyone who did receive the J&J vaccine in the past 3 to 4 weeks are advised to monitor their symptoms. However, Dr. Mendoza says the risk of getting COVID-19 is far greater than the risk of this side effect. 1 in a million. That's how many people have experienced the rare blood clot side effect after receiving the J&J vaccine. Dr. Michael Mendoza says it's possible these 6 people may have developed the clots without even getting the vaccine.
Right now we have an association that we need to understand. We need to see if the vaccine was in fact the cause of these side effects, but we don't yet know that. So I don't think we need to panic.
Dr. Ed Walsh from Rochester Regional Health says the clotting issue has affected 6 women under age 50 with low platelet counts. He says the patients experienced persistent headaches and abdominal pain.
It's a very rare event. I wouldn't lose any sleep over it. I would pay attention to symptoms and not ignore them should you have them.
Dr. Mendoza says the blood clots developed in close proximity to each other.
Those who have gotten the vaccine more than 3 weeks ago have nothing to worry about. We are advising anybody who has gotten the vaccine within the last 3 weeks to pay attention to your symptoms as you ordinarily would.
The CDC says this pause may only last a few days. Both doctors encourage everyone to get the Pfizer or Moderna vaccine while this one is on pause.
Clearly, the risk of dying from COVID far exceeds the risk of dying, say, from one of these very rare 1 in a million events.
Dr. Mendoza says that the county is working on rescheduling people who were supposed to get the J&J vaccine to get the Moderna or Pfizer vaccine, and he says that they will keep everyone posted as they work on that. He also says they weren't scheduled to give any J&J vaccines this week in Monroe County, but any that were left over from last week will be stored. Live in Rochester, Kayla Green, News 8.
All right, Kayla, thank you.